Hi everyone, this is Deepu Gowda. I just wanted to give you a quick intro to an exercise that we're going to do in tutorials related to self-directed learning. And this will apply to your write-ups. So this is really for students and faculty. And I just wanted to quickly give you an intro into what is self-directed learning and why are we doing it in our course. Self-directed learning basically is the lifetime learning activity that physicians are engaged in, meaning most of what you know as a clinician is not based on what we end up teaching you in medical school. Most of your learning in clinical practice comes from seeing a patient, having a question, going to the appropriate source, and using that information to answer the clinical question you have and make some changes. So what we're doing in the write-ups now is explicitly incorporating this cycle into your write-ups. So let me take you through the steps, okay? So step one is very straightforward. It is, what do you want to learn and what specific clinical questions do you have based on the case that you have worked up in tutorials? So for each case in tutorials, we want you to identify maybe one or two questions that you have. And the question could be very broad, like, hey, what is the pathophysiology of COPD? Or it could be very specific. What is known about, mortality reduction with the use of systemic steroids in patients that have a COPD exacerbation? That's an example of something more specific, right? So it could be a whole range. Based on that question, the next thing we want students to do is go to the appropriate information source that will help you find the answer to your question. And so if you look here, there's a couple of links I have. This link was developed by several faculty members at Columbia, and this actually takes you through different types of questions that you might have and what the appropriate information sources are for those questions. And here's another document that kind of consolidates all of that information into one place. And if I were to, condense this down into the most essential items, it kind of goes like this. If your question is very foundational, things like the epidemiology of an illness, the pathophysiology of the illness, how it presents clinically, what's the history and physical, of a basic illness, go to a textbook. Go to a textbook, potentially a review paper, systematic review by Cochrane, things like that. If it's a more specific question, like specifically about the most current treatment or really trying to answer a question in a very specific patient population, you may need to go to places like UpToDate or may need to go to PubMed to look for individual papers. That's a very, very simplistic kind of approach to this, but that's kind of what we're getting at. And I hope that, going through this module, and I encourage the faculty to do this too, this will be great learning for you, and looking at this document here will help you get a better grasp of what we're talking about in terms of the appropriate sources. The next step after you go to those sources is to take that knowledge and apply it to the question that you have, right? Apply it to the case that you're taking care of. And so if your question was, hey, how does COPD present? What are the presenting signs and symptoms? And you've gone to Harrison's to get that information, what you're going to do then is take what you've learned from Harrison's and apply it to your case and say, this is how COPD exacerbations typically present. And in our case, patient Miss M, she presented with shortness of breath, which is consistent with the classic description of how COPD presents. That's an example of how you're going to take what you've learned and apply it or integrate it into the case that you're taking care of. And the last process is to kind of look at the whole process itself that you went through and do some self-assessment and get feedback from your preceptor. So let me and then what I'm going to ask you to do, and these documents are are going to be sent to all the faculty and students. You'll be able to reference these documents. The next thing we want students to do is actually take this text that is found, in the material that we're going to post on Courseworks and email to you. Take this whole section from self-directed learning exercise, etc., all the way down to the end of this, right? And basically copy and paste it into the end of your assessment section in your write-up, okay? And after you've copied and pasted it, what you're going to do is fill out these sections. So just like we just talked about, section 1 is state your learning objective and state the question that you have. And we ask you to come up with 1 or 2 questions per write-up, all right? Section 3 is briefly write up your findings. And 1 or 2 paragraphs is sufficient for this exercise and tutorials. Here's where you're going to take the information you learned, you're going to apply it to the patient that you have, and you're going to try to make sense of your situation given your newfound knowledge. And section 4 is provide the references that you used, right, with links. And then what you want to do here is for the reference you chose, let's say you chose 1 or 2 references for each question. Write the reference here, put a URL, or if it's an article, go ahead and put the reference information there. And then state why was it chosen. Very straightforward. Doesn't have to be a huge long description, but it can really be a 1 or 2 sentence description for why did you choose that particular reference, right? And that's it. And it seems kind of formulaic, but we're trying to simplify the process as much as possible and trying to make explicit, which absolutely is a central part of being a good clinician. This is something you're going to do when you get to MCY, and you're going to do this for the rest of your career. So we want to introduce you to this process right here and now in the foundations class. And then the students are also going to copy and paste this feedback section into the write-up. And this is where faculty are going to go through each of these competencies that we just talked about and basically circle one of these things. It was not evident that the student did this, or the student did it in an excellent fashion. And quickly going through each of these, it aligns exactly with what we just talked about. First step is, did the student identify a learning objective? Did they ask clear questions? Did they identify the appropriate resource? And some of the guidance I just gave you can help you answering that. But I also encourage you to go check out the module that's posted there to get a little more information and educate yourself on it. But based on the module and what we just talked about, did the student have a good description for why they chose the references they chose? And I'm sorry, did they choose the appropriate references, and did they actually describe the reasons for choosing that reference? And did they then summarize that learning into the brief report, into the write-up? Did they take their newfound knowledge, and did that help them make sense of the case that they're seeing in tutorials? And then here's a section for you to write a sentence or two for feedback, so to give the students some information. And faculty members, if you get your write-ups electronically, and you usually make notes electronically, you can fill this out electronically and send it back. Or if you usually print it out and write your comments on your write-ups, you can do the same thing for this section as well. So I hope this makes sense. We don't want this to be a super arduous process. A lot of students are doing this already in their write-ups. This just kind of makes it a little bit more formal, and it makes each step explicit so that you know why you're doing it and why it's connected to being a really effective clinician. And that's what we're all here for. And for students, this will really prepare you for what will be expected of you once you get to MCY as well. So thanks for listening, and this is our first time doing this in tutorials in a kind of formal fashion, so we're very open to your feedback, but I hope you enjoy it, and best of luck. Bye-bye.